Hello friends, today we are going to learn about dental chair and patient positions. Until few decades ago, most dental procedures were performed with a patient seated upright and a dentist standing next to the patient. However, standing for prolonged period and bending over the patient results in poor body posture and creates musculoskeletal disorders for the dentist. Hence, to improve the health and endurance of dentist and the comfort of the patient, most restorative procedures are now performed with the dentist seated and the patient in supine position. And we all dental students need to understand early in our course the significance of proper operator and patient position so as to ensure a long and productive career ahead. So, starting with dental chair. Dental chair. The very important and the first thing in a dental chair, it should support the patient's head, back and arms. Modern dental chairs are contoured to provide total body support and comfort for the patient in any chair position. The patient's head is supported by headrest cushion, which is attached to the chair back and is adjustable or articulated. And the headrest supports the patient's head and slightly elevates the chin, thus reducing the strain on the neck of the patient. The switches for chair adjustment should be easily accessible to the dentist, and the foot switch are preferred so that the dentist can avoid hand contamination during the treatment procedure. While making the patient sit on the dental chair, the chair height is kept low and the backrest is upright so that the patient can sit with ease. And during the examination or treatment procedure, the chair is tilted back. Talking about patient's seating positions, the choice of chair positions can be decided by the dentist based on the type of procedure and the arch being worked on. For operative dental procedures, the patient may be seated in one of the following positions. The first one is almost supine position. In this position, the chair is tilted so that the patient is almost in a lying down posture and the patient's head, knees and feet are approximately at the same level, and the head should not be positioned lower than the feet except when the patient is in syncope. So we have to keep it in mind that head position should never go lower than the feet. The second position is reclined 45 degrees position. In this position, the chair is reclined at 45 degrees so that when the patient is seated, the mandibular occlusal surfaces are almost at 45 degrees to the floor. Once the treatment is over, the chair is brought back to the upright position so that the patient can leave the chair easily. And as I already told, the choice of chair position can be decided by the dentist based on the type of procedure and the arch being worked on. Now talking about operating stool and operator's position. First we will talk about operating stool. Nowadays there are several designs of operating stools available. The stool should be on casters for easy movement and be sturdy and well balanced, and the seat should be cushioned and allow up and down adjustments as well, and the backrest should afford adequate support for the dentist. So how the operator should sit on the stool? The dentist should sit back on the cushion using the entire seat of the stool. The upper body should be upright or only slightly bent forward well supported by the backrest. The thighs should be parallel to the floor and lower legs perpendicular to the floor with feet flat on the floor. Now let's talk about operator's position. For a right-handed operator, there are 4 positions recommended, which are right front or 7 o'clock position, right or 9 o'clock position, right rear or 11 o'clock position, direct rear or 12 o'clock position. These positions are on the left side for the left-handed operator. If the right-handed operator is working on the patient, then these positions are all positions are on right side, and for a left-handed person, these all positions should be on the left side, but the positions will be the same. For example, for a left-handed person, it will be the right front position will be left front, and right position will be left, and right rear position will be left rear, and direct rear will be direct rear. For both the cases, direct rear is the same. Let's talk about each positions in detail. First of all, right front position. This position is convenient for examination and working on the mandibular anterior teeth, mandibular right posterior teeth, and maxillary anterior teeth. For added ease, the patient's head may be slightly turned towards the dentist. See in this picture, as you can see, this is a dental chair and this is the stool. The stool is placed at 7 o'clock position, that is right and front position of the patient. If the patient will be sitting in this like this, the approach of the dentist will be from here, which is a front position, and it is on the right side of the patient. That's why it is called right front position or 7 o'clock position. Right position. Here the dentist sits to the right of the patient, while that is extreme right of the patient, while working on the facial surfaces of maxillary and mandibular right posterior teeth and the occlusal surfaces of mandibular right posterior teeth. Let's see this also in diagram. See, this is the dental chair and this is the stool. So the dentist is sitting just right to the patient. The third position is right rear position. This is a preferred position for most of the procedures, and from this position the dentist can have a good access to the most of the areas of the mouth using direct or indirect vision. See in the diagram, this is the dental chair and this is the stool. The dentist is sitting just rear to the patient. It is not extreme rear, it is just rear position in relation to the patient, and that's why it is called right rear, or it is called 11 o'clock position. 11 o'clock position. The next position is direct rear position. It is extreme rear, that is almost 90 degrees. Here the dentist sits directly behind the patient and looks down over the patient's head. This position is mainly used only for working on lingual surfaces of mandibular anterior teeth, and it can also be used while working on the lingual surfaces of maxillary anterior teeth. So for maxillary and mandibular both anterior teeth, we need to sit in this position, which is a direct rear position. We can see this in the diagram also. As we can see in the diagram, this is the direct rear position, which is just behind the head of the patient, and it is also known as 12 o'clock position. So we have 4 positions, that is right front position, which is 7 o'clock position, right position, which is 9 o'clock position, right rear position, which is 11 o'clock position, and the last one is direct rear position, which is 12 o'clock position. We need to keep in mind some additional points while observing or while practicing the proper sitting position. We will see this. Some additional considerations are mentioned here, so we'll go one by one. The first one is the patient's head can be rotated according to the operator's need to allow good access and visibility to the work area, which in turn will greatly minimize the strain on the operator. The main purpose of tilting the head of the patient is to minimize the strain on the operator. The second one is generally while working on the maxillary arch, the maxillary occlusal surfaces should be oriented approximately perpendicular to the floor. Similarly, while working on the mandibular arch, the occlusal surface of the mandibular teeth should be approximately 45 degrees to the floor. The dentist should maintain enough distance from the patient, such as while reading a book, but for some detailed preparations or inaccessible areas, closer proximity to the patient may be required for adequate visibility. A very important aspect of proper operating position is to reduce the body contact with the patient, because no one likes it. Sometimes the patient must be of opposite gender. That time it will be very uncomfortable for the patient also, and it will be uncomfortable for you also. The dentist must never rest his forearm on the patient's shoulder or hands on the patient's face or forehead. It is a golden rule. You should never do this. While working for long periods of time, the dentist can keep changing the positions to reduce the muscle strain and fatigue. There are certain rules for instrument exchange also, so that the working will be very comfortable and easy for the dentist as well as for the patient. Proper instrument exchange between the dentist and the assistant will maximize the operating efficiency, which is must nowadays. With the patient in the dental chair while practicing, the transfer of instruments between the dentist and the assistant should occur only in the exchange zone. So, what is this exchange zone? This exchange zone is below the patient's chin and several inches above the patient's chest. So, I guess everyone got this point. The exchange zone is below the patient's chin and several inches above the patient's chest. Instrument exchange should never be done over the patient's face. This should be marked that it should never be done over the patient's face. It is very irritating for the patient also, uncomfortable also, and there might be some chances if any instrument will slip, it will fall off on the face of the patient, which is also very embarrassing situation for an operator. While doing any dental procedure, the lighting of the room or the operatory should also be considered. The operatory should be well illuminated either by natural or artificial light. During patient's examination and treatment procedure, the operating field must be well lit, and this is achieved by operating light which is situated above the patient's head. The position of the operating light can be adjusted according to the area of the mouth being examined, and usually the operating light is kept at arm's length from the operator and its position adjusted so that it falls directly on the oral cavity for better view. So, if the light is kept too close, it will hinder the physical movement within the operating field and also increases the patient's discomfort due to heat production. And on the other hand, if the light is kept far away, it reduces the illumination of the working area. So, as a rule, the operating light is kept in a lower position while working on maxillary arch using indirect vision, and the light is kept in higher position while working in the mandibular arch using direct vision. Got it? Magnification. Nowadays, there are certain dentists who are using magnification instruments for better working. Magnification of the working area enhances the visibility and enables the dentist to pay good attention to the details of each procedure, and several magnification devices are available such as magnifying loops, surgical operating microscopes. Magnification is useful at any age to enable the dentist to precisely perform delicate restorative procedures like composite restoration, cast restoration, etc. So, why people are using it? If people are using magnifying instruments, there must be certain advantages to that. So, let's see the advantages of magnification. The first one is the magnified view of the small repairs to existing restorations, clearer picture of the fine details of the tooth preparation, better posture for operator, and improved diagnosis. Thank you for watching my video. Friends, if you like my video, please subscribe my channel and ring the bell icon for latest updates.